KIRO, Seattle. This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
Rumors have been circulating for weeks that the National Guard might make an appearance here in Washington state.
The federal government has much more limited powers than we often think.
A constitutional law expert weighs in.
Also, the region's homeless response ramps up amid the outbreak.
Plus, why is the media giving so much coronavirus coverage compared to other deadly diseases?
Stay with us.
Governor Inslee's stay-at-home order does not apply to the state's homeless population.
But they are urged to find shelter as soon as possible. And King County has been taking a lot of measures themselves. They've been setting up homeless clients in motels. They've also brought in modular units to provide shelter for people who do not have homes. And this is a really big concern, Dave, because we know that the homeless population is among the most vulnerable that we have in our region. And we know that this coronavirus, if it does spread in a homeless population, that it could be a big problem. I've talked with homeless response teams, and they tell me that the populations that they come across, they often have some sort of underlying conditions and quite frankly, just aren't the most healthy.
Right, and who might not be practicing proper separation. The last count, as I understand it, found more than 5,000 people living unsheltered, not having homes last year. And one of the questions is, what do you do now that we couldn't do before? I mean, we had trouble finding shelter for them when times were normal. And now you have to find not just shelter, but you have to provide sanitation. And in some cases, you might have to isolate people.
I mean, keep in mind, these are encampments that don't have things like running water, don't have toilets, basic necessities that you would need to stay clean. So what King County at least has done and the city of Seattle is doing is they're trying to increase, hygiene and sanitation services. I know that the navigation team has been going out and giving out kits essentially with hand sanitizer and just water, soap. They're trying to link them up with other resources that if people are still outside, then they can hopefully find a shelter. Of course, one of the other major responses here is trying to increase shelter capacity as well.
I saw that part of Seattle Center has been opened up as a temporary shelter for homeless people. But this is going to be pretty expensive, as I understand it. What figures did you find on what the cost of this might be?
Yeah, I came across a report from the National Alliance to End Homelessness. It would cost, and these are nationwide numbers here, but $11 billion to shelter every homeless person at least 6 feet away from each other, so to socially distance them, and if they need to be isolated as well. So the total cost there would be about $11 billion. In King County alone, we're talking more than $250 million.
I wonder, I haven't heard yet if there's been extensive testing of homeless people or whether these camps are in fact a place where the disease has been transmitted. So far, the problem seems to be people who are sheltered and who gathered at parties or at religious events, for example, where the spread seemed to be most prevalent.
Yeah, I haven't seen any figures either myself. And as far as I know at last check, at least the King County and the regional homeless response teams, they have not mentioned that anybody in our homeless population has been infected. We'll have to keep an eye out for that, though. At this point, you probably heard the rumors about the National Guard helicopters flying over Seattle, possibly closing our state's borders. Governor Jay Inslee calls those claims false, and the National Guard itself says it has not been called upon to enforce Governor Inslee's stay-home order. In fact, the National Guard can't just show up here. The governor has to invite them first. Professor Hugh Spitzer teaches constitutional law at the University of Washington, and he joined the G and Ursula show today to explain how it all works.
The federal government has much more limited powers than we often think. And what's called the police power, that is the ability to regulate over people's everyday lives, that's pretty much in the states. And then in the local governments, if the states want them to have those powers.
So he says the federal government's hands are pretty much tied. Even if the president tells everyone they can go back to work, Governor Inslee can still keep the doors locked.
So the federal government could lift its guidelines, but that wouldn't make any difference in states where the governors under state law were continuing to enforce more stringent guidelines. I'm pretty sure that the federal government's quite aware of this. I know the CDC is aware of it. And I just read an interesting article this morning, a legal article, calling for federal legislation that would actually give the federal government more power. Just that shows you that the feds really don't have those powers today.
So how will the governor actually enforce his stay home, stay healthy order? Officers say they are focused on more of an educational approach and dispersing crowds, but you still can receive a fine.
The governor and the mayor have very, very strong powers to enforce these orders, much stronger powers than I expect they would ever use.
And if the governor does call on the National Guard, it would be the state that is in charge of them.
If the National Guard were activated by the governor to assist here, and that hasn't happened, they've just been approved for use, as I understand it. It's some technical term. And if necessary, I don't think it would be necessary here, but if it were necessary, by statute, the governor can order the militia, that's what the old statute said, here the National Guard, can order the National Guard when required for public health to execute the laws and perform whatever duties the governor deems proper. Another law says that when that happens, the militia or the National Guard becomes an additional police power. So the bottom line is the militia can be used, or the National Guard can be used, along with the police, to keep order.
That's Professor Hugh Spitzer. He teaches constitutional law at the University of Washington. President Trump seems to be downplaying the deadliness of the coronavirus. This week, he compared it to the flu.
We have a very active flu season, more active than most. It's looking like it's heading to 50,000 or more deaths, not cases, 50,000 deaths, which is, that's a lot.
He also talked about deadly car accidents, saying they too far outnumber the COVID-19 death toll, which today stands at nearly 21,000 worldwide. So, Dave, it is a fair question. I mean, why are we talking so much about this virus compared to other deadly diseases?
Well, that is the big question. A lot of people are asking it, and it's absolutely a fair question. And I got a couple of answers when I talked to Dr. Keith Jerome at the University of Washington. For one thing, he says it's more infectious.
Easier to spread, easier to catch. We're trying to understand the biology behind that. And, of course, the research typically doesn't happen over days. It would happen over weeks.
And nobody has any immunity to it.
In flu, lots of people have gotten a flu shot, even if it's not perfect. It helps. We had flu last year. Maybe that helps a little bit. And then just honestly, what we're seeing is that the fatality rate of infections is substantially higher.
The mortality rate is about 1.25, so that's about 10 times higher than the flu. That's the percentage of people who get it and who would die of it. So it is somewhat deadlier. But that also means that the vast majority, you could say almost everybody, recovers from this disease. So why is it scarier? Well, to my mind, the reason, it's a couple of things. Because it's new, and there's a sort of mystery to it. It seems to be especially contagious in groups. The symptoms don't appear until about 2 weeks after you've been infected, and during that time you can spread it, so it seems to be spreading faster. But the other part is there's no vaccine. With the flu, you kind of have a choice as whether you want to be vulnerable to flu or not, right? There are people who, despite the availability of free flu vaccines, don't get it. They can make that choice. With this, you've got no choice. You're not immune, no matter what. Some people have a better resistance to it than others, but you can't stack the deck in your favor by getting a vaccination. The other thing that's significant to me is, let's look at the experience of China, right? China is basically a police state. Capitalist, but a police state. They couldn't control the messaging on this. They tried to pretend, this is just like the flu. But you can't pretend that the hospitals aren't full when they are. And that's the thing, I think, that made this different than anything else. When you saw what was happening in China, you realized you couldn't just jawbone this and make it go away, because people were starting to die at a rate that the hospitals couldn't handle. And that's why this has become such a big deal.
And if I may add, Dave, a large amount of cases are people who get it and don't show any symptoms at all, people who are asymptomatic to this disease. So you could have it, you could be transmitting it and not even know it.
Right. I mean, that's a good thing if you can get it and not even feel it and then get over it. But if in the process you're infecting people who don't have that kind of resistance, that's when you start to overwhelm the healthcare system. So that's our update for today. We'll be back tomorrow, and we'll be back every day with a 10-minute rundown of the daily news. You can also subscribe to this podcast and follow our news coverage on mynorthwest.com or listen live on 97.3 FM.